Welcome in, everyone, and thank you for tuning into this week's recap of the Lansing Watchdog, your trusted source for small business news. As always, I'm Francesca Rocco Ellis.
And I'm Jacob Manning.
And Jacob, you have quite a bit of good news to start us off this week.
Yes, that's right, Francesca. Last week we had a huge victory as the Michigan Senate passed Senate Bill 1011, allowing small businesses to band together to purchase health insurance across industries. And the best part, the bill passed unanimously, 35-0, with all present members, Republicans and Democrats alike, all voting yes. Now, this is legislation that we've been closely following, given that it is a key piece of our legislative agenda. By joining together in risk pools, small businesses will be able to collectively spread the cost of high claims, making coverage more affordable and predictable, and avoiding buying coverage off the rack. Small businesses can be solely responsible for their own risk. They don't have to subsidize the entire system as they have been, and they can be rewarded for implementing effective health and wellness programs that drive down utilization, all of which they can't currently do because of existing restrictions on pools. Now, as a reminder, our recent survey data highlights the urgency for these health plans. Nearly 80% of small businesses reported double-digit increases in healthcare premiums last year. More than 75% said that rising costs are limiting their ability to hire. And the real kicker, 42% said that they may have to drop employer-sponsored coverage altogether within the next 1 to 3 years if trends continue as they have been. Senate Health Policy Chair Kevin Hertel was the champion of this bill in the Senate. He sponsored the legislation, and he emphasized that this is a proven, straightforward policy solution that can be implemented right now. Healthcare costs are affecting hiring, wages, and whether businesses can continue to offer benefits at all. And association health plans provide a pathway for small businesses to stay competitive and to continue offering coverage. The legislation now awaits further action in the House, and we will continue to advocate for it to move over there. Thank you to all members who submitted a call to action response last week to your state senator. These messages really do make a big difference and helped us get to that 35-0 vote. Now back to you, Francesca. Today is actually the budget deadline. Do you have an update?
Yeah, so last week, legislative leaders in Michigan State Budget Office have agreed on department level spending targets for the fiscal year 2027 budget, which is an important step towards finalizing the actual state budget. This agreement allows House and Senate appropriation subcommittees to move forward with negotiating the final details. Now, the broader goal here is to get the budget finalized by early July, even if it misses the statutory deadline of July 1st. Now, key budget principles shaping negotiations are no new increases on taxes, no use of the rainy day fund, and keeping overall spending below current fiscal year levels. Lawmakers are working quickly behind the scenes, with much of the detailed work being handled by legislative staff racing to meet a July 2nd or 3rd timeline. The primary focus from Senate Appropriations Chair Sarah Anthony is addressing the budget shortfall and prioritizing essential services like Medicaid and food assistance over special projects. Now, a major point of contention is legislative directive spending items, often called pork projects. Now, lawmakers have requested a combined $4.38 billion for over 1,300 projects. These requests include funding for local infrastructure, nonprofits, workforce programs, and community improvements, but not all may make it into the final budget. A newer transparency law is shaping what gets included. Requests must be made publicly posted at least 45 days before passage to be eligible, and some proposals may already be disqualified for missing that deadline, highlighting stricter accountability measures for this year. Example of these proposed projects include workforce development funding, energy efficiency lending programs, local park restoration, and courthouse construction. However, the balancing act lawmakers are facing is closing the budget gap and maintaining core services overall. So the big picture takeaway is this year's budget process is being driven by fiscal constraint and tighter rules, forcing lawmakers to prioritize essentials over extras while working on a compressed timeline. So we'll continue to keep listeners up to date on the latest budget details. Like I said, hopefully we will be making that deadline of early July, given that today is the deadline and we won't be seeing anything tonight. But throwing it back over to you, Jacob, what can you tell us about some testimony that you provided last week?
Yes, so it was definitely an eventful week for the advocacy team. On Thursday, I testified in the House Government Operations Committee on a package of bills that seeks to implement transparency requirements and controls on hospitals and health systems. So we talked about this package in last week's program, but as a bit of a refresher, this package is ambitious. It would create a hospital cost review board that would oversee nonprofit hospitals, similar to how Michigan's utilities are currently regulated by the Michigan Public Service Commission. The package would also institute a series of price controls on health systems and would require price hikes to be rationalized and justified. So SBAM's testimony focused mainly on stating the issue. Healthcare coverage has gotten too expensive for employers. And as I mentioned earlier, if trends continue as they have been, employers will no longer be able to offer insurance benefits to their employees at all. We hear stories from members about premiums increasing by $2,000 per employee per year. And these sorts of increases require businesses to make tough decisions elsewhere in their business, especially as they try to deal with other new requirements that pop up, like the Earned Sick Time Act. We know that hospital care accounts for the largest section of the premium that employers pay, and that those costs have increased much faster than the rate of inflation in a time when health systems can continue to consolidate, build new facilities, and report generous profits, all like we've never seen before. We addressed in our testimony that this package of bills is aggressive and that there is still a long way to go and a lot that we can talk about. But given the severity of the situation, bold solutions are going to be required. We are interested in looking across the board at legislative changes that could help bring down prices, whether that be hospital systems, insurance, pharmaceuticals, PBMs. We're happy to talk about anybody, but we will continue to advocate for the problem to be addressed urgently because the issue is urgent. Now, you can watch that testimony on SBAM's YouTube page or social media. It's also linked in this week's newsletter as well. Francesca, can you close us out for the week?
Absolutely. And with that, Jacob and I wish you a great rest of your week, and we'll catch you next week with more updates.
Have a happy 4th of July.